Welcome to Plain English Public Health Weekly Report. I am Richard Greenland and today is July 31st, 2020. As always, we start our report with the COVID-19 statistics. Worldwide, we have over 17.5 million cases and over 678,000 deaths. In the United States, we have over 4.6 million cases and over 155,000 deaths. I want to start by addressing something big in COVID-19 news that happened this past week. On Monday, a group called America's Frontline Doctors held a long press conference. During this press conference, they tried to pass false information off as true. Some of those falsehoods included saying that hydroxychloroquine was a valid treatment for COVID-19, saying that masks were unnecessary to prevent the spread of COVID-19, and saying that COVID-19 is not dangerous. They made other false statements, but the gist of it all was along the same lines. We've already dealt with all these different falsehoods in the past. We've explained them in a lot of detail. So I'm not going to go into detail this report. Feel free to look at past reports to get more information on that. Normally, we here at Plain English Public Health would just dismiss these kind of things as another case of misguided people not understanding the COVID-19 situation. Unfortunately, this press conference went viral on multiple social media networks. Even President Trump retweeted it. So thankfully, it was quickly banned and removed within a day because of all the incorrect and even dangerous information that was in there. Despite the short time it was available, it is quite possible that quite a bit of harm was done because of this. It was presented originally as something official, something that was actually truthful, when in reality there was pretty much no truth at all to anything they said. The press conference did not provide any new information. It just regurgitated a bunch of discredited information that's been around since basically the beginning of COVID-19 pandemic. So this is an example of why it's so important that we be informed and to make sure we are trusting in accurate sources of information. In this case, the group behind the press conference, America's Frontline Doctors, has a long history of questionable medical advice, not just on COVID-19. Some of you may be asking, isn't a lot of the information on COVID-19 contradictory, or isn't a lot of this just people's opinions? We admit that some aspects of the response to COVID-19 may be opinions, such as whether or not children should go back to school, and what the best way is to reopen the economy. Both liberals and conservatives have good ideas, and it would be advantageous to take the best of both sides. Even those issues, however, do need to be influenced by the facts that we do have, instead of just basing decisions on what's popular or politically acceptable at the moment. A number of seeming contradictions have also popped up during the pandemic. For example, at the beginning of the pandemic, we were advised not to use face masks unless we were sick, working in healthcare, or caring for someone who is sick. Now, we're advised that everyone should wear a face mask in public, whether you feel sick or not. Also, at the beginning of the pandemic, many people thought that hydroxychloroquine was a valid treatment for COVID-19. Now, we know it is not. These and many other changes in guidelines for COVID-19 are just due to us gaining more information, not because the first things were completely wrong or they were something that shouldn't have been done, but just because we gained a better understanding of the situation. They're not contradictions so much as clarifications. Unfortunately, many pseudo-scientific groups have latched onto the previous guidelines and just won't let go of them. Even though many new studies support this new information that we have, those groups can't seem to accept that science is about finding the truth, even if that means abandoning what was once thought of as truth. For example, people once thought the world was flat. We now know it's not. There's still flat earthers out there that still believe it's flat. Even though they believe it, it doesn't make it true. So we need to stick with the science. Same thing with COVID-19. Moving on to more news about COVID-19, the CDC has stated that about 1/3 of patients who show symptoms but are not serious enough that they have to be hospitalized, they stay sick 3 weeks or longer. Some even stay sick for months. This was among all age groups and levels of healthiness, not just senior citizens or anything like that. This is a big difference from the seasonal flu, because with seasonal flu, 90% of all people that aren't hospitalized end up being completely healthy again within 2 weeks. So once again, this is not the flu. We've mentioned this multiple times in the past, but that falsehood keeps coming back. But COVID-19 is not the flu. It is more dangerous, it spreads more easily, it is a pandemic. We need to make sure that we understand this. A new study suggests that using estrogen, such as in birth control or hormone therapies, while being sick with COVID-19 may increase the risk of blood clots. Now, estrogen, estrogen supplementation already increases the chance of blood clots slightly, as well as COVID-19 also does that. And so both, having both in conjunction can make it even worse. The study said it was still too early in the research to recommend that women stop all use of estrogen, but it did suggest that women speak with their doctors just to see if there's any other options available that would maybe be a little safer during this time of COVID-19. A little more news about face masks this week. Disney World has now banned masks with vents or holes in them. We talked a little bit about this last week, about the venting. You can go ahead and rewatch that report if you'd like to get more information on that. A new study has shown that in order to be effective, face masks need to have at least 2 layers of fabric, preferably 3 or more. A single layer doesn't work very well because of some of the reasons we've talked about in past reports. A couple of those reasons are, one, the virus is so small it can fit through those microscopic holes, and if there's not another layer behind those holes to kind of block it, then it gets through much more easily. And another reason is that the electrostatic charge that normally builds up in multi-layer masks, it'll still build up a little bit with a single layer, but it's not anywhere near as effective as if you have multiple layers. So it's just much weaker and can't block it as well, going both in and out of the mask. Also, an emergency room physician in Utah, Marion Bishop, recently offered advice for those who say that wearing a mask is uncomfortable. I've included the link to her original article below the video, but I'll go ahead and summarize some of her suggestions. First off, practice using a mask. Even if that means wearing it for an hour or 2 at a time, in your home, doing your normal day-to-day activities, that can help you get used to wearing the mask. Also, try different masks. Some types of masks are more comfortable for different shapes and sizes of faces. So you may find one that works better for you. Also, breathe through your mouth if you feel like it's hard to breathe. Or you can try sucking on a mint or chewing a piece of gum. Or just slow down. Usually those that have trouble breathing, it's mostly because of trying to do too many things while wearing a mask, and your body just gets labored, your breathing gets a little harder, and so it just becomes a little more difficult. Again, there is no reason or there's no proof of any hypoxia or hypercapnia, having too much carbon dioxide or having too little oxygen. You're going to be fine. It just sometimes feels like it's a little hard to breathe, and so these tips can kind of help with that. Also, if you have glasses and they fog up, you can try some anti-fog wipes on the glasses, or even just a little drop of shampoo and rub it around on your lenses. Or you can try moving your glasses further up or down on your nose, and sometimes that will help. If you have trouble understanding what others are saying, or they have trouble understanding you when you're wearing masks, there's 3 main things to try. First, try speaking up or asking them to speak up. Second, pay full attention to the person speaking. Instead of trying to do something else and listen at the same time, just pay full attention. You'll most likely understand what they're saying. And third, use body language. Body language can really help a conversation go more smoothly. Following these tips can help making wear a mask easier for everyone. If you have any further tips of your own, feel free to comment below the video and you can share with everyone. As a follow-up to previous reports about toxic hand sanitizers, please note that the list has expanded quite a bit. It's all because of the methanol. Methanol is one of those ingredients that is just super toxic, and for some reason a lot of the newer companies that are jumping on the bandwagon trying to make money off of it are including methanol. In fact, there are some brands that can actually be found at Walmart and Target, or at least they could before they were taken out of there because of the recall. But we need to be careful. The list is, or there's a link below the video, so you can check out that list and see if the hand sanitizer you have is on that list. If it is, please get rid of it right away. We have some good news this week about treatments and detection for COVID-19. First off, an extract from seaweed has been found to fight COVID-19 even better than remdesivir, which is now the current standard for treating COVID-19. So far, this has only been tested in the lab. We haven't had any clinical or human trials of this extract yet. But once those trials are done, if it shows that it's still just as effective, then we should be able to get a very effective medication made out of it fairly easily, since this extract is found in seaweed that's used for sushi and other dishes like that. So it should be very easy to find enough of it. A review of many current and upcoming drugs has found 21 medications that are likely to be able to fight COVID-19, based on what we currently know about how COVID-19 works in the body. So further testing is necessary, but this is extremely good news that we have that many different medications that have a possibility of beating COVID-19, or at least helping with treating it. We've also learned this week that dogs can be trained to detect people who are sick with COVID-19 with 94% accuracy. That's amazing. The training is going to take a little while to get everyone trained, all the dogs trained for that, but we do have another way of detecting that now. Instead of trying to take temperatures and all that, which sometimes doesn't show up correctly, this is 94% accurate, so that's great. In non-COVID news this week, the CDC has warned about a Salmonella outbreak in 23 states. They're unsure yet as to what is causing this outbreak. They just haven't been able to track it down yet. But they are asking that everybody be more careful in how they wash and prepare any types of food, especially those that are common to have salmonella, such as poultry. Another study has been able to has been able to use a blood test to detect cancer up to 4 years before any other symptoms show up. So this could help us catch cancer way before it becomes a major issue. It would still be very, very young and much more easy to treat at that point. And another blood test study has found that they can detect Alzheimer's disease in patients up to 20 years before the memory loss and thinking are affected. It may take a few years for both of these tests to become commercially available, but when they do, that'll definitely change how we go about fighting cancer and Alzheimer's disease. Our final bit of news this week is about a new review of studies that has shown that any increase of plant-based foods such as vegetables, fruits, nuts, and whole grains in a person's diet can lower blood pressure and reduce the risk of heart attacks, strokes, and other diseases. You don't need to become a vegan or a vegetarian to benefit from this. Simply add more plant-based foods to your diet and decrease the animal-based things like meat and dairy. You don't have to get rid of them completely or anything like that. Every little bit helps. Just get a little bit more plant-based foods into your diet. Thank you for watching the Plain English Public Health Weekly Report for July 31st, 2020. I'm Richard Greenland, and you have a healthy weekend.